that in that process. So one last thing I really wanted to mention as a rationale for this work are the incidents related to gender, such as intimate partner violence and all forms of gender-based violence, and really how so often they occur in emergency contexts, especially during large-scale evacuations. And when we don't address these issues, and there can be cascading impacts that create risks not only for the affected community, the host community, but also for emergency management personnel. And we really benefited from having Dr. Slick on our team, who wrote a great journal article about gender-based violence in the context of emergencies in Canada. But lots of others, Valarosa, Amaratunga, I'm going to miss lots of them because I can't see my presentation notes. And the Gender and Disaster Australia folks have all written really interestingly, the Canadian Women's Foundation, etc., on these the association of gender-based violence and emergencies and disasters and what we need to do. All right, so let's go there. We built our framework on the foundation of sex, gender, and equity-based analysis. It's something we do in all of our work, but here we'll just talk about it specifically in this context. But of note, for those of you who are interested as students and researchers and others in bringing sex and gender-based analysis into your work, it involves these steps: critically examining the research, describing the differential impacts for different populations, biological, social, cultural, and economic factors, generating ideas about the differential impacts that are either we already know or we can predict, so that all of us can design tailored responses. And it doesn't end there. I'm going to talk at the end lots about how we measure and continue to measure as we go along, about how things are unfolding from a sex, gender, and equity-based lens. So here's where I wish I had my presentation notes, but we know that sex really affects our experience. All these sex-related factors impact us in disasters. And, at the center, we use this 4-quadrant view of sex, thinking about hormones, genes, physiology and anatomy, and neurobiology. And if I just focus in on the physiology one for the purpose of this presentation, here's an example of some of the research we found: that post-earthquake, females report higher rates of at least one somatic symptom, such as headaches or gastrointestinal issues, and experience more disruptions in sleep, weight, and appetite compared to males. And that's by an article by a researcher named Karmasi and a whole team of researchers with them. Really covered well in the IJERTH version of the documents. Lots more about how sex matters in emergencies and disasters. In terms of gender, gender is also really in play and, connected to sex as well. So we again use a 4-quadrant model of thinking about gender, not only gender identity, but gender roles, gender relations, and institutional forms of gender in laws and rules and regulations. So again, in the IJERPH article, lots more detail on all the studies we found that talk about gender-related factors and emergencies. But we can just look at roles, for instance, that stricter adherence to traditional feminine or masculine gender roles have been associated with poorer mental health outcomes following disasters. And lots of has been written related to this, and you'll see it shining through the work as I go along. So together with sex, gender, and equity-based analysis, we also really wove through these 3 essential approaches. And I'm only going to mention the gender transformative part today, so that I don't go too long in the speaking, but lots to be said in all 3 of these approaches. But the gender transformative part is about having 2 goals at once, of improving emergency responses along with simultaneously improving gender equity. So here's kind of what it looks like visually, I guess. You know, this importance of moving from gender unequal or gender blind approaches over to gender transformative ones that address the causes of gender inequities and include ways to transform harmful norms and relations as we're doing the work on gender and disaster. And if you want to know more about gender transformative approaches, Dr. Greaves and I and Dr. Peterson edited a book a number of years ago called Making It Better, Gender Transformative Health Promotion. And this graph and many other things are included in it that may be of interest to you, to those of you who are interested in this approach. But basically, we're trying to improve health outcomes and improve gender equity together as we go along. And, you know, actually, it's not additional work. It's just, you know, doing better, not harder, I guess, as we go along. Okay, so the framework we came up with after having done 3 rapid reviews on different aspects of sex, gender, and equity in all different kinds of emergencies, and I'm probably going to get these wrong, but hydrological ones, meteorological ones, biological ones, and the earthquake, tsunami type ones, which I forget the name of, but hopefully you can jump in and help me on this. Anyway, we looked at all forms of disaster and those 3 approaches, sex and gender-based analysis. And we tried to build on what the Chief Public Health Officer did around her definition of the emergency management continuum that I'm sure many of you are well aware of. That includes prevention and mitigation, preparedness, response, and recovery. Now, we created in our framework in a slightly different version, just kind of melding them together a bit more because, of course, they're not distinct and they overlap. So here we are at the bottom with the sex and gender-based analysis, thinking about the determinants of health, thinking about these key approaches in the context of these different aspects of emergency and disaster management, really thinking about how we pull people in so that our responses are community driven and participatory and inclusive and empowering as we go, so that we end up with gender equitable outcomes in all those domains, not only in health, but in all these aspects. And that takes us back again to, refining our understanding of determinants and the approaches, etc. So I'm going to talk a bit about how we thought through bringing these areas of action into each of the levels of or components of emergency response continuum. So, for example, in the preparedness component part of the continuum, if we think about awareness and network building, one of the ways in which we might do that is by identifying, learning from, and forming partnerships with community-based groups such as women's violence and community health organizations, so that preparedness information reaches a wide audience, but also, really more importantly, is delivered by trusted community members and is tailored to the groups that they serve. And, the document that's pictured here, I don't have my notes, I'm gonna have to go into the framework, is one that is really interesting by the Red Cross. And what they did was they analyzed vulnerability, such as family structure, proportion of single mothers, and mode of transportation. And they combined that with data on infrastructure and the built environment, so that by mapping those risks and vulnerability to floods, they could create a tool that supports tailored disaster risk reduction outreach to the various communities. So really showing how we can do differently. In the response area, thinking about implementation actions that we can do. One of the things is really lots about making gender-based violence and intimate partner violence services recognized as critical services, so that in the context of emergencies, those services are able to keep responding to violence as it emerges. And also that shelters have, menstrual products, lactation support, protection from gender-based violence. This is a great toolkit by Alex and published by the Canadian Women's Foundation, that talks lots about that, risk assessment and integrating gender analysis into the actual assessments of risk. So in the recovery phase, and thinking about the action of planning and involvement, is really thinking about how advocacy groups are engaged in leadership roles, highlighting how there are structural inequities and the need for thinking about women's rights in recovery processes. So as I think we said along the way here, so that men not just assigned picking up debris, but and women assigned to cook the meals. But we are actually thinking about assigning roles in recovery by skills and interests, not by, traditional gender roles that are limiting and in many cases harmful. And, in this Resilience Rising report, some of the Indigenous communities mentioned the importance of, yes, the women in community being able to be the nurturers and cookers or bakers in the context of emergencies, but also being able to assume roles of communication across communities and being directly involved in as emergency responders. So lots of ways in which we can involve girls and women and their organizations and interests in recovery planning, implementation, and evaluation. Also applies in the prevention and mitigation area. I picked the examples of how we could monitor in that context, and thinking about how we can really pay attention to things like at the prevention level. Two of those are disproportionately impacted by disasters, such as we saw in COVID, of older women in long-term care and their particular vulnerabilities. But also really thinking about the National Inquiry into Missing and Murdered Indigenous Women and Girls, and thinking about how we can incorporate their recommendations into the work we do in prevention. So we've got pages of indicators of how you might measure bringing sex, gender, and equity-based analysis and gender transformative approaches into emergency and disaster management in our report. And I just wanted to point out that as we did it, we thought about quantitative measures and qualitative ones, recognizing that oftentimes in emergencies, only the quantitative ones have been really talked about, and that, these ideas of having community testimonies on whether our leaders demonstrate sensitivity, as well as having numbers about how many emergency management officials are trained in these important approaches. So lots to think about as we think about indicators of awareness and networking, but also in planning and involvement. Are women and girls from diverse backgrounds and their representative organizations and networks being actively consulted to ensure their needs, priorities, and capabilities are fully understood and considered? And again, you can have percentages in your plan, but you can also have the actual feedback. And in the context of implementation, do we have systems in place to conduct rapid gender assessments at the outset of a disaster and to sustain these assessments during response and recovery? So again, the numbers matter, but also that we have these tools and we see how they're working. So we come up with all kinds of indicators in the context of this report, and really see it as important that we don't see that somehow bringing gender transformative approaches into emergency management is some kind of impossible add-on that's just theoretical, and it's, instead we've tried to make it so concrete. Here's examples. Here's how many people we list in this report, all kinds of examples where people have already done this well, and just recognizing that it is so doable and it is so important, and we can measure it. And it's not a huge add-on. The measuring of it, it's these kinds of, measurement tools are totally doable. The percentage of emergency management programs that collect and report on sex, gender, and equity disaggregated data. So possible to do. And oftentimes, the data is being collected, but it's not being reported on. It's not being thought about of what is going on here and how could we mitigate negative health impacts as we go along. Okay. In summary, our GEMF framework, Gender and Emergency Response Framework, highlights the impacts of sex, gender, and a wide range of intersectional factors on all types of disasters and all phases of emergency management. And hopefully it facilitates community groups, planners, government leaders, teachers of emergency management, students of emergency management, etc., and the general public in building responses that decrease harm and increase resilience, especially amongst women and many other vulnerable groups. And the application of these lenses, and I've only really talked about the gender transformative one today, but of the trauma-informed and equity-informed approaches, really does hopefully make sure that solutions are indeed building back better, not just in the infrastructure, but also in the status of women and other vulnerable groups. That as we're thinking about recovery, we're thinking, have we got the childcare centers going again? So women can participate in ways that are important to them, not only fixing the roads, but also all the aspects of response together. And we can do this by deliberately including intersectional sex and gender-based analyses. We can seek to improve gender health and social equity, and we can measure the outcomes. So that's my story, and hopefully we can turn to lots of discussion on this work. And I will just stop sharing here.
Thank you so much, Nancy. I personally really enjoyed, very informative, very well crafted, the presentation. Thank you so much. I have a couple of the questions, but as I always, I give time to our participants. So please feel free if you have a question for Nancy. So yeah.
Oh, it's great. And Lorraine is here. Lorraine, please answer too. I didn't realize you were here. That's so great.
Yep, I'm here. Great, Nancy.
That's amazing. Thank you so much also, Dr. Grave, for joining us.
Okay, fire away.
Oh, yes, we have one. Erin, yes, go ahead, please.
Thank you for this presentation. This overlaps with the research that I'm particularly interested in right now on improving disaster outcomes for trans and gender expansive folks.
Oh, excellent. So great. Someone's doing this. We didn't
Trying.
find a huge amount. We looked for it and we documented a bit in here, but
yeah,
so great you're doing that, Erin.
Thank you. I guess one of my questions is, yeah, Public Safety Canada helped to fund this research. Is there like any stated intention for further funding, just with the complicated nature of governance in Canada, where ultimately a lot of things ends up being downloaded onto municipalities who don't have the resources? So has there been any conversation that you've heard about that on a federal level?
Not on the federal government level per se, but we are pursuing further research funding through the CIHR as we go forth. Because 1 year, you can see the dash we made to get to all this in 1 year.
Yeah, totally.
So we're hoping to be able to involve many others, including people like yourself, in a team grant going forth that actually expands, the research in this territory. But what the government is thinking in terms of the chief public health officer and the Public Health Agency of Canada and public safety, etc. I have no idea.
Thank you. I have other questions, but if anyone else has questions, go for it.
Oh, sorry, I was muted. So far it's not there's no more question. Please go ahead, Eric.
One of the things that stood out for me was also like the perception of integrating equity as extra work. This came up a lot in my cohort for disaster emergency management at Royal Roads, where there was like a really big tension where particularly depending on which zone of practitioners, so like folks who were more familiar from a social determinants of health perspective working in healthcare versus some folks who were doing other things where it was very much perceived as extra work and was an ongoing conversation. So and I think one of the other things that really stood out for me, and I'm wondering if you've done more or dug into it more, is the harmful gender roles piece after disaster. And I see that as also really impacting practitioners, where there is like this, to be general, like stoic working cultures, and there's a lot of folks who are really struggling with mental health and that kind of thing, and a lot of that I have perceived as being connected to perceived gender roles.
Yes.
Yeah.
Really important. I'm just trying to find it in here. Yeah. One of the studies we looked at, or reports we looked at, because we decided to use lots of gray literature as well, because oftentimes that's where the action is happening. It doesn't get into the research as quickly as it might. But one of the things we found was an action plan for increasing diversity and inclusion for women in the Canadian Fire Service. And a key component was celebrating women and gender diverse leaders in the fire sector and ideas for improving the workplace environment, support, and mentorship. Right. And I think your point is really well taken, that a lot of this, work is so important in general for all of us in our, daily lives in responding to emergencies. And it's not an add-on, it's just a way of making our lives more easier, I guess. And, I teach trauma-informed practice at the Justice Institute of BC for a range of people, you know, police and victim services and corrections and first responders and all different types of people who study at the JI. And you know, I really feel that this idea of trauma-informed and gender-informed and equity-oriented approaches are just at the core of what everybody's hungry to be doing and seeing as important at this time. And I'm so encouraged by people signing up for these courses, like, how do I practically do trauma-informed practice? Not just be aware of it as something, you know, that would be nice, but something that we can do here. And all our lives will be better, both us who are the responders and the doers in services, but also the people in communities with various vulnerabilities to disasters and emergencies, whether those are physiological ones or related to, you know, racism and, you know, sexism, et cetera, et cetera. Yeah, I think this is a really important area of work, and I'm so glad Royal Roads is teaching on gender, on emergency management and thinking about how to bring these issues into that work. I've attended a couple of the other lecture series and seen people very much interested in equity-oriented approaches of various kinds. I think we're at the, you know, front of something that's really going to accelerate over the next few years, and hopefully we can be super helpful in that process.
Perfect, amazing. Thank you so much, Nancy. As you mentioned, yeah, but this is one of our central concern and one of the, you know, the polar concern in our program, and we believe that it needs to be discussed, to bring it up, to be covered in all educational program in the disaster and emergency management. This is one of the focal points in the program, and we hope that we will dedicate more time, more courses to discuss about the gender equity and gender-based equity in post-disaster emergency and recovery. Do we have any other question? Or it might be my turn to ask my question.
Great.
Yes.
Bring it on.
Perfect. Nancy, as I mentioned at the beginning of the presentation, I also am a little bit involved in this topic. With my PhD student in Iran, we are, you know, exploring women's agency in post-disaster recovery and to shifting the community in more resiliency, not only for the benefit of themselves and their family and surrounding, but more in general in their community. The community that we are studying right now is a very remote community. It's a particular community in the north of Iran. And they had the experience of the flooding in the 2019, if I'm not mistaken. And then after, in that very, I would say that religious, but at the same time patriotic society in the community, they stand up and they played very important roles in the bringing you know, the recovery of the community, and also to make the community even more resilient in a different regards. My question for you is that to what extent do you believe that your framework that you offers is right now is a theoretical framework? It's perfect, but with the implication in practice and very well fitted with in the context of for the context of Canada. To what extent do you believe that this framework can be replicable in different contexts? more specifically in the less developing countries and in the different societies where they're dealing with some challenges and limitations, something like being in the religious country or living in the patriotic community. How do you see that those barriers can be addressed, and how your framework can help to address those barriers?
Yeah. Well, first of all, I just want to say that Lorraine and I have worked quite a lot with Australia and the Gender and Disaster network there. And thinking through, the response in different kind of rural and remote places that have wildfires, Indigenous communities, etc., over time, and thinking about how to tailor to that particular context. But one of the things we found actually as we went through the literature was there's tremendous work that's been done on gender and disaster in developing countries. In fact, I would say they may be more far advanced in understanding gender transformative than we are in Canada. And groups, and documents like the Sendai framework, etc., offer really detailed approaches to bringing these kinds of considerations, thinking through in a whole bunch of different locations. Now, I can't remember whether any of them specifically worked in Iran and facing the particular things you mentioned around religious restrictions that are really patriarchal in their, way of thinking. And, I think it really could be a great place of practical shift is using this kind of gender and emergency response as a place for discussion about more equity, because clearly in that context there's a lot to be thought about, no matter what religion or race or class or gender that you are, and how we can have solidarity, how we can work together. And so I guess I kind of see this idea of emergency and disaster planning and involvement of a whole range of parts of society, some who are more oppressed than others, in seeing that's a topic that people could really get behind, to be inclusive with. And that's why we thought about, wrapping that inclusivity idea around the emergency management continuum, because it has huge opportunities for taking some of those ideas forth by a really wide range of people, organizations, different contexts, different kinds of emergencies, etc. So actually, I think, given it's pretty simple and straightforward as a framework, that where we attempted to be so practical in the development of it, as well as justifying it in the research end, that I think it could be a really great place to use it in contexts such as what you've described. I don't know what you think, how possible that is.
I think, yeah, for sure, that's possible. Yeah, thank you so much for your very, the detailed answer. I love it. I think that's possible, but my concern is that a little bit I'm reflecting on also Aaron's question about the necessity of equity right after disaster and during the emergency. As we observe, for example, in the different cases, especially, for example, in the context of the Iran and the emergency, it might be a little bit, difficult to implement that because of so many challenges and, the disputes and also the controversies in that regard. But as we understood in our study, the community is more lean toward bringing the equity discussion, gender equity discussion in the recovery phase, in the long-term recovery phase, when the dust is settled, a little bit established, the community, that this emergency phase is over, then that might be better timing to sitting and talking and also bringing a little bit of the gender equity discussion in the recovery.
I used to work with a woman musician named Heather Bishop from Manitoba. And she talked a lot. She taught before she became a musician, she worked in women in trades and whatever. And she talked about how farmers in various contexts, when one farmer had a problem of some kind, how others across rural Manitoba joined together and went to that farmer's place and helped them rebuild, And she did some songs about that kind of response as well. But I really do feel that emergencies, and like you say, in the recovery phase, is a really important time when some of our, petty differences can be overcome by the kind of solidarity and the helping together that that these responses require. And I think, this document we've done is tried to signal that, that gender is one big place of difference, that where often, there are restrictions that can really be opened up by everybody participating in new ways as well, that go beyond those restrictive roles and responsibilities and laws and procedures, into a whole much more empowering place. And so, I feel that this is such a key area for us to move forth on equity-related issues, more than almost any of the other topics, that there's interest and a history of that kind of pulling together in emergency that really could spark a very important social movement.
That's great. Yeah, I agree with you. It's very important. Thank you, Nancy. We have a few more minutes left. I just wonder, do we have any other question from our participants? Please feel free. Or comment or any point that you wanted to discuss, both with Nancy and the Dr. Grave also. She's with us.
Yeah, we're always super interested. If I just share my screen once more, we're always super interested in people staying in touch with us and connecting with us on gender and health related issues and social justice in general. I just wanted to mention that you can follow us on those various social media things. You can email us. We have an email, or you can just follow us with our newsletter as well. And we'd love to have people, get in touch. And if you think about something you'd like to connect with us on a month after this, totally fine. Like we close but never doze, so to speak, or doze but never close, whichever way around that goes.
Yeah, that's a great initiative. Thank you so much. I already scanned your QR code and I have your page in front of me. I think it's a very good idea for facilitating that communication later on.
Great. And thanks for your questions and Aaron's questions too. And I hope, Aaron, you get in touch with us for sure. Excellent.
And I would say that, yeah, I was before wrapping up the session, I would apologize for forgetting to press the recording button early in the presentation. So just we missed about 5 minutes of your presentation. That's a bit unfortunate, but at least we have a big bunch of the chunk of your presentation already recorded.
Excellent.
Yeah, thanks again, everybody, for joining us today. That's amazing. We have more lectures already scheduled. And also, please, if you're interested to listening to our previous lectures, please check our website, our webpage, and join us for the next presentation, next lecture in October. Thanks, everybody, and have a very good day.
Bye for now.